Welcome to W.B. Saunders Company Critical Thinking Skills video series. This unique series has been designed to help you develop critical thinking skills. Although it is important to know your facts, working in a real medical office challenges you to translate facts into wise decisions about patients, employers, and fellow employees. In order to help you develop your critical thinking, we have created a series of improvisations using real medical assistants responding to patients portrayed by actors. The actors are following a predetermined scenario about which the medical assistant has no knowledge. The medical assistant is only aware of the basic information on the medical chart. You'll see how medical assistants respond in lifelike situations. Sometimes their critical decision-making is sound. Sometimes it needs to be amplified or even corrected. We're not trying to portray perfect medical assisting. We ask you to watch and develop your critical thinking skills by evaluating theirs. Following the scene, the medical assistants comment candidly on the reasons behind their decisions. This provides you with another opportunity to evaluate and learn. There are 6 tapes in the series: legal and ethical professionalism, communications and caring, medications, phlebotomy, patient education with special populations, and insurance. I hope you enjoy the series.
One of the greatest challenges for medical assistants is to help patients understand and follow their treatment plan. This can be especially difficult with a patient who does not speak English or is mentally challenged, such as someone with Alzheimer's or mental retardation. In the first scene, Sandra, a medical assistant, is instructing a Hispanic woman, Mrs. Hernandez, and her daughter Maria about making changes to Mrs. Hernandez's diet because of her high cholesterol and blood pressure. Let's see what happens when Sandra tries to get Mrs. Hernandez to change her diet.
Miss Hernandez, my name is Sandra. I work with Dr. Lopez. He asked me to come in.
She doesn't speak.
I'm sorry. I'm sorry. I don't speak any Spanish either.
All right, then you can talk to
you
me.
Are the daughter?
Yeah, I'm her daughter.
And you?
Mary.
Okay.
Yeah.
Mary. My name is Sandra. I work with Dr. Lopez, and he asked me to come in and talk to you regarding your mother
Sí.
and her diet.
Okay. Great. Ella quiere hablar de la dieta, mami, de la dieta, de la comida.
I'm going to give you a low cholesterol sheet to take home and read over. You might want to review this with her.
Okay.
When we leave, though, you don't have to. It's nothing you have to do now. It's not that pertinent. But I just want to.
I'm sorry. It's just really. She's always eating the same food, mami. Cuestiones de la dieta, porque el colesterol está muy alto, está muy alto, mami. Porque can you what is it that she needs to change?
Well, she needs to change. Let me just see what Dr. Lopez had said. I think Dr. Lopez says that the salt in her diet is just a little bit on the heavy side, so he wants her to stop the salt.
Tienes que cortar el sal completamente, que el sal es veneno para el colesterol y también para el corazón.
But this is going. One momento. This is going to help her with ideas on cooking without salt. Do you live at home with her?
No, I don't.
Okay. All right.
¿Cómo se come sin sal?
Bueno, mami, no se usa sal, es muy sencillo.
Pero no tienen en español.
No, mami, solamente lo tienen en inglés, pero yo te lo puedo leer. Mira, tienes que cortar carne.
Would it be easier if I could find her something in Spanish?
That would be great.
Okay. I'm not sure we have any. But we actually just ran out, but I can put an order in for one and I can mail it to her as soon as I get one. But in the meantime, I think it's just something that you need to go over with her so she can start this tonight. This is actually a very good sheet because it's cholesterol and low salt together.
Okay, so,
Yo no entiendo el colesterol. Ay, no.
¿cuándo se, mami,
It's actually not that, I understand she's probably frustrated, but it's actually not that hard. Does she eat a lot of fish?
pescado, mami, casi
Ay.
no. No, she doesn't really eat fish. She eats a lot of
Really?
pork and puerco le gusta y carne, a lot of meat. También hay cuestiones del aceite, mami.
I think she just needs to try this for approximately a month. A change of her diet and a change in her salt.
What are the-
Y tu papá
And
también, tengo que cocinar para tu papá
Sí, pero mami,
también,
a
mija.
papi le hace
No, a
bien
ver, ¿qué
también,
dice
mami,
esto?
cortar el sal, porque
¿Qué dice?
ya te he hablado de...
It's not forever. Just remember that. It's not forever. You're just going to change your diet.
No es para siempre, un mes, 2 meses, 6 meses.
Ah,
Entonces, no
un
para
mes y
siempre.
luego ya no necesito que...
Bueno, eso es lo que dice
Después de
ella.
un mes nada más. No.
Okay, I think, you know what? I think you're all set. I think that this is just something, just take it home, read it over, try it. It doesn't work, call the nutritionist. And I know you have to go to the pharmacy, so don't forget to stop there and pick up your medication. Okay?
Okay,
And you should start that tonight also. Tonight before she goes to bed, she should take those 2 pills.
Oh, okay.
One for cholesterol, one for blood pressure.
All right,
That's
colesterol,
it.
la presión sanguínea, helado. Okay, great.
Okay? If she has any, if it's, don't worry about it. Just try it. You know,
Okay.
it's not that bad. You'll see it's not that bad. I've had a lot of people come in and they say they really like, the diet's not that bad. They like it, so. It's a lot of chicken. It's a lot of chicken.
A lot of chicken.
And once you make the diet change, I think you'll see it works. So,
Okay, terrific.
alrighty? It was nice to meet you.
Thank you very
All right,
much.
you're welcome.
Thank
Take care now. Thank you. Yep, bye-bye.
How successful was Sandra in establishing a rapport with Mrs. Hernandez and getting her information across?
These type of patients, the ones that I just saw, the Hispanic is common everyday occurrence. We probably have a schedule of, say, 10 patients, and 4 out of 10 patients are Hispanic. We work with a lot of family members that are interpreters. It's mostly family that always comes with the patient, whether they be 10 years old or 70 years old. I did okay getting the doctor's orders across to the patient, thanks to the daughter Maria. And I'm just sorry that I don't speak Spanish, or my Spanish is very little. And, but we did okay. I think we did okay. The frustrations are very little for me. I felt the frustration for the patient, one, not having a Spanish cholesterol salt-free sheet to hand her. I feel inadequate that I don't speak the Spanish, but I'm picking up words and understanding, so I don't have a problem with it, as long as they don't have a problem with it.
How did Sandra help motivate Mrs. Hernandez to follow the new diet and take her medications?
I find Mrs. Hernandez will have a problem following the diet. I find she won't have any problems taking her pills, but I think she's going to have a problem with the diet because it's a big change for her. And I don't think she's going to be able to do it without a lot of support from her family, a lot of help from the nutritionist, and I think it's going to be a while before she gets any kind of a diet change. If a patient is really adamant about the diet change, then I might have to stress that the cholesterol was a little bit on the high side, a little bit too high, and this is the reason for a change in diet. And if a change in diet doesn't take place, along with taking medication on a daily basis, then this could be very threatening to her health.
What are the particular problems for a medical assistant helping a patient who doesn't speak English and has grown up in a different culture?
I can help people make changes in their diet by 1, developing a relationship with the patient. 2, by doing phone follow-up and giving them lots of support. And 3, by coming back in 4 to 6 weeks for more support and follow-up blood work. I was in that room about the right amount of time that I would be for a person with a background, an ethnic background. They can be very time-consuming because everything has to be translated. And there are lots of things that people with a different background, with no medical experience, from a different country, a lot of things that they don't understand. So you have to be patient, which I have lots of patience, and some kindness and understanding, and it's just a lot of smiles and a lot of reassurance.
It's difficult and time-consuming to introduce new ideas about health and diet to people from another culture. It is particularly hard when the medical problem does not cause a lot of symptoms. When Mrs. Hernandez returns for her next appointment, her cholesterol is still high and her blood pressure has risen.
Todavía sigue la presión alta, tan alta.
No, yo creo que se
Hi,
equivocaron,
Ms. Hernandez.
mijita.
Hi, how are you? Hi, remember me? My
Good.
name is Sandra. We've talked on the phone
Yes.
at least once.
Hello, Sandra.
How you doing?
Good, good.
Good. Dr. Lopez asked me to come back in again.
Yeah.
¿Va a venir el doctor?
No, mami, el doctor no viene. Sandra nos va a ayudar.
Let me just tell you that I only have a few minutes because I don't want you to be late for your nutrition appointment
Right.
because she has a very tight schedule. So I just want to tell you that I finally got this in Spanish.
Oh, great.
Okay.
Mira, mami, en español. Mira.
Yes. Okay. So I'm going to give you this to take to the nutritionist.
Thank you so
okay?
much.
Gracias,
And-
gracias.
Yes.
Yeah.
Gracias. Right. And but just to remind your mother about taking her medication.
Okay, mami, you know, there's been a problem with that. La medicación, mami, que no la estás tomando.
It's okay. You know what? There's no sense getting upset about it because it's not worth it. But just continue to
Well, I mean,
remind
is it
her.
worth it or is it not worth it? I mean,
Well,
should she take it or not?
It is worth it because her cholesterol. Did Dr. Lopez tell you about her cholesterol?
¿Qué dice del
El
colesterol? mija?
colesterol that's higher, that it hasn't
Yeah.
gone
¿Qué,
down.
qué, amigo?
Que-
¿Qué?
And I
que
think
está
that's-
más alto, que no ha
El
bajado.
colesterol.
Sí, el colesterol en las venas.
And you know what? I think it's because.
Sandra may have recognized that Maria understood the problem and could possibly help her mother acquire new habits. But how do you think Mrs. Hernandez felt when Sandra focused the interview on her daughter?
I was trying to look at Mrs. Hernandez out of the corner of my eyes by responding in a low voice because I didn't want her to think that I was actually talking about her. I didn't want to hurt her feelings because I know being an older woman with some kind of a diagnosis that she can be very sensitive. So I was hoping that she wouldn't really take notice of my bypassing her and talking more softly to her daughter Maria. So I'm hoping she really didn't notice.
We suggested to Sandra that she might have more influence on Mrs. Hernandez if she looked directly at her when she was talking. We suggested that she try to make emotional contact and use her authority as a representative of the practice to help Mrs. Hernandez make dietary changes. Let's see what happened when she tried a different approach.
Sabemos que tenemos que escuchar.
O alguien que hable español.
Hi, Miss Hernandez. How are you? Remember me? My name is Sandra. Maria, hi. How are you?
Yes, hi.
I found the sheet in Spanish.
Oh, ay, mira, oh, that's
Ay,
great.
gracias,
Thank you so
gracias.
I'm so sorry that it took so long.
Sí, le da mucha pena que tomó tanto tiempo. Thank you so much. It's
You're
great.
welcome. I just want to go over. Can you just talk to your
Yeah,
mother? And,
sure.
and I don't
ella
want
va-
to keep you too long, Maria. I'm sorry because she has a
Right,
nutritionist
tenemos la
appointment.
cita para hablar de la comida Y entonces, ¿vamos a pasar esto?
But, Ms. Hernandez, I just want to let you know that Dr. Lopez just showed me your blood test results, and they came back a little bit higher than the last
Sí,
time.
¿Qué
mami,
dice el doctor
que
López?
sigue
¿El
la
doctor?
presión sanguínea muy alta, mami, sigue alta.
So,
No ha bajado casi nada. It hasn't gone down really at all.
Ms. Hernandez, it actually went up a little bit.
Ha
It went
subido,
up.
mami.
So
está
I
más
just
alta.
want to make sure that you're taking your medication every night or once a day, however you take it
Sigue
every
tomando la
day.
medicina, ¿verdad? Yeah, sí, de la presión sí. Yeah.
Oh, sí, de la presión, sí, de la
she's been
presión.
taking-
Yes.
the
Yes,
problem has
okay.
been with the
And
cholesterol medicine has been
the cholesterol
has been a
medicine,
problem.
Ay, pues,
Sí, pero mami, no, dime.
no puedo, es muy cara.
It's just very expensive. And they're fixed income and
okay, you know what? You know what I can do? I can talk to the social worker
Ella
about
puede-
your medication and
ella puede hablar con alguien para ayudar a pagar el
Ay,
cuest-
me la,
Sí, sí, sí,
me
te
la
lo pagan,
dan
te lo pagan.
gratis la medicina.
no, it's not free, but it'll be.
no, it's not going to be free. I'm
Pero-
going to talk to the social worker. I can't guarantee. I think she can probably reduce the cost, maybe get it free. It depends on your income.
Sí, I can help her fill out those
yes,
papers. Yo te
yes,
puedo ayudar con los
absolutely.
papeles y todo. Vamos a hablar con
But I just want to
alguien
go.
que
I
me
just
pueda
want to go
ayudar.
over a few more things regarding your diet.
Okay, la dieta.
Ah, pues
sigue-
aquí tengo todo ya, y ahora sí puedo leer.
Are
esto
you?
de
I
aquí.
want to make sure. Are you eating more chicken?
pollo.
More?
Mucho
What-
pollo.
Oh, good,
Mucho.
good. Okay.
Mucho
We've been
pollo.
got her some cookbooks and magazines, las revistas, mami, que yo te compré.
Sí,
And
sí.
beef? Have you cut out the beef?
La
Totally?
carne. Less.
Very okay. Good. That's good. Let's see. What
And,
did
and
Doctor?
the pork, puerco, un poquito también, a little less pork. too.
Okay. Alrighty. And salt.
La sal, mami. Dile la verdad.
La comida no sabe bien, sabe horrible
This
sin
is- it
sal.
tastes terrible
¿Cómo voy a
without the
sin
salt.
sal?
Okay. All
I've
right.
tried, really. I have
Ay,
been.
no, es la sal. No,
A
no,
li- have you cut down a little bit?
¿Has cortado algo? ¿Has cortado?
Pues,
Not really.
pues es que es imposible cocinar sin sal.
Okay.
Dile, mijita,
Yes,
dile.
she understands.
Okay.
mami, she understands.
I want you to. I don't want to hold you up because you have to see the nutritionist.
Is it really
Okay?
that important?
You know what? Taking your medication and doing your diet is very, very important because
Muy importante, mami.
You-
Tú entiendes, muy importante.
you can get very sick.
Yo no
Very
quiero
sick.
que te enfermes, que te vas a enfermar. El corazón se va a poner flojo y es muy importante, mami, para salud, para
And your blood pressure.
la
Blood
presión
pressure.
sigue también, la
No.
presión sigue muy alta. I've been trying to get her to exercise a little.
Salt is a big factor with your blood pressure.
La sal terrible, la sal es veneno, mami.
So, and just a reminder that you're taking the skin, as it says. I don't speak Spanish, so
Yes,
I
yes,
can't
yes,
read this.
right.
But you're remembering to take the skin off your meat, whether it's chicken, pork, beef.
Ay,
Are you
quitarle,
taking the-
es que te tienes que quitarle el pellejo al pollo, mami.
Ay, no, es que se la
She's
quito
been-
y hago
She's been
chicharrones.
making fried chicharrones with that. Ew,
Oh,
so,
you know
um,
what? No more, no more.
Porque eso tiene mucha grasa,
no more.
mami.
Talk to the nutritionist. Your appointment's in 2 minutes, okay?
Okay.
So I want you to. I'm not going to tie you up. I don't want you to be late. She has a terrible, tight schedule.
Ya, sí, es muy importante llegar a tiempo.
So I'm going to have you come back in 2 weeks. We'll recheck.
En 2 semanas vamos a regresar con ella.
Otra vez, mija.
Pero, mami, ¿qué
Eh,
vamos a
no,
hacer?
you know what? You can come back anytime that's convenient for you and Maria.
Cuando podemos.
Así no tengo que tener
No,
cita.
vamos a
ni-
mirar el calendario. Yo vengo contigo y
Anytime, we're just going to do a blood pressure check. You don't have to see Dr. Lopez. You can only see me. Remember, my name is Sandra. We'll do your blood
Sandra,
pressure.
sí,
Yes.
sí,
Sandra.
sí,
Sí,
es
Sandra.
muy buena.
Yes.
Sí.
And that's it. You'll be in and out anytime. You can come. I work till 5:30.
How did Sandra work differently with Mrs. Hernandez and Maria?
This time I directed my conversation directly to Mrs. Hernandez. I actually felt very frustrated talking to Mrs. Hernandez. I focused more on her face, and I found her turning directly, her face would turn directly to her daughter for an interpretation. So I almost found that there were a couple of times I wanted to turn her shoulders more towards me. But I think that's just typical. I think my position was correct talking to Mrs. Hernandez. What I realized after talking to Mrs. Hernandez is that I need to pick up more words in Spanish so I can communicate more effectively.
How well did Sandra communicate with Mrs. Hernandez?
I think Mrs. Hernandez understood exactly what I was saying. I think she could tell by my hand language, some of my body language, and I think she's picked up on some of the words. I think she knows. I don't think I had more control. I think that I wasn't getting enough eye contact with Miss Hernandez. When I talked to Maria the first time, I felt more in control, actually, and I felt I was getting more response. And Mrs. Hernandez was looking to Maria for support and for interpretation. So I did not feel more comfortable this time around talking to Miss Hernandez. By body language, I tried to make her understand me and look at me more by using hand signals and some body language and just touching her. After today, I think Mrs. Hernandez has a better understanding of the urgency of taking her medication and watching her diet and continuing to exercise.
Do you think that Mrs. Hernandez will follow Sandra's instructions and that her blood pressure and cholesterol will lower as a result of this visit?
Her attitude and the language that she was speaking back to her daughter after I talked to her, I could tell by her body language and by her tone that she understood. And I think we'll see more compliance and more results with the next visit. And working with people with cultural differences, you need a lot of patience, a lot of sensitivity, and respect for their background, where they've come from. It's a whole different ball game over here, and I feel very sympathetic towards them. So I try not to push them, and everybody has their own pace. And as long as the doctor that I'm working with is willing to work with their pace and not rush them, everything will work out eventually.
By talking directly to Mrs. Hernandez and using her daughter as an interpreter, Sandra was able to make a more effective connection, even though Sandra said she felt awkward and less in control. Mrs. Hernandez was clearly more engaged. Sandra was able to reinforce the importance of Mrs. Hernandez being responsible for her own health by taking the medications and following the diet. The second part of this tape features Sue, a medical assistant, trying to help John, a mentally retarded patient who has broken his arm. John lives with his brother Hal, who brought him to the medical office and is with him in the exam room.
Okay, John, so can you be good? We'll get out here quick. I'll buy you
Hi,
milkshake.
John. I'm
hurts.
Dr. Hughes, medical assistant. John. Hi. My name is Sue.
Hi, John. This is Sue, okay?
Hi. What
say hi?
happened?
He broke it. He tripped. He doesn't pick up his feet,
You
and he
tripped?
tripped, and he falls down.
Too bad. And now it hurts, doesn't it?
It hurts. here.
Yeah, they're gonna fix it, John.
John, we're going to take you down to the cast room and put a cast on it.
It's okay, John. It's kind of like duct tape. You remember when we fixed the chair? All right, they're gonna fix you right up. Okay,
It's
you're
some
gonna be better.
stuff that goes on soft and wet and then turns hard to hold your arm in a position so it won't move anymore. So your wrist can't move.
Okay, you're gonna be okay.
No, on my arm?
Yes. Once we put the cast on, it won't hurt so much.
Okay. Speaking of hurt,
Because
it
it
hurts.
hurts.
It hurts. So
No.
can you get something for this? You know, for the pain now, because
Not on my arm.
It
what is
will,
it, John?
No.
John, when you move your arm at all, it hurts now. The cast will protect it so it can't move.
Oh, okay. This cast is on for how long?
Casts are usually on for 6 to 8 weeks.
6. Okay.
I just want to make sure he understands what we're going to do before we go down.
Yeah, I think the problem is
John?
he hurts
Do you
right now.
understand?
It hurts.
It
It hurts.
hurts.
Right.
I'll ask Dr. Hughes if we can give you something to make it not hurt so much. And once the cast is on, it will hurt less too.
Okay.
Cast.
The cast I just explained is going to be on there. It'll hold it. It's hard.
John. Okay. They're gonna fix
Okay.
it. Just do what the
We're
lady
just
says.
going to go do it right
Okay,
now.
just do it.
Okay?
Just do it, and we're out of here. Okay.
Oh,
All right.
Okay, John, you understand?
okay.
You understand it's okay? Okay, good, good. Okay, come on. If you get
How did Sue try to adapt her explanation to the patient's level of understanding?
I've dealt with patients with mental handicaps many times in the past. It's a challenge. I was trying to get the patient, the person with the broken arm, John Daly, to understand that he was going to have a cast and what a cast is, and to be comfortable with that. I thought it was tough. I didn't think that he could really understand what a cast was, and the minute that he heard that we were going to do something, he was very negative about it. I tried to set the patient at ease by talking to him in a very direct way, by getting him to look at me, and by showing that I understood that it was uncomfortable for him. And I tried to have him understand by using shorter sentences and explaining things at a level that I thought that he could understand. I try to treat everybody like a person that's important to me, no matter where they're coming from or what they're like. And I have been told in the past sometimes that that sometimes it looks like I'm talking down to someone, because sometimes I slow down too much, I get too simplified, I speak too simply, and that's just my style. But I never mean it disrespectfully, and I think that people pick up on how you feel about them. I think that you make a connection between people and you feel a certain way about them, and I think people know what that is after a while.
How did Sue deal with the way the brothers related to each other, and which brother did she choose to focus on?
In this particular situation, I felt it was most important to communicate with John, the patient, and try to establish a connection and try to make him feel comfortable. I wasn't at this point so concerned with his brother, because I know I'll get a chance to explain things to his brother later. I felt that this communication was really difficult to manage because the brother was interrupting, and the patient was hesitant to have the procedure, and it made it really hard, you know, to manage the two of them because they seemed to be in totally different places. I thought that the two of them had a relationship that made me uncomfortable. I thought that the brother was I thought that the brother was actually not very nice to the patient. And in the situation, all I could do was to try to pretend it wasn't happening. I didn't feel I had time to intervene or to do anything about it, and if I responded to it, it would have made me mad, so I just sort of ignored it.
How would you have handled the situation differently?
I think that if I had it to do over again, I would take him down to the cast room or the treatment room where we're going to put the cast on before I tried to explain it to him, because I think that he just couldn't make the mental picture of what we were going to do. In general, when somebody has limited understanding, a hands-on type of thing, something they can see, touch, feel, is much more effective than just words. Even a picture would have been better.
When talking with mentally challenged patients, it's important to speak simply and clearly, to make emotional contact, and to make repeated attempts to communicate non-verbally. A person who feels accepted and cared about has a better chance to become involved in their treatment and make any changes that are medically necessary. After the cast has been applied, John and Hal return for a visit. Notice how Sue's priorities change in the scene as she shifts her focus from John to his brother.
I know I'm late.
Hi, I'm back.
Maybe in
John.
a half hour.
You all done?
I'll be back.
Look what you got.
I have to work. I have a job,
You have a job? What do you do?
We're gonna be,
groceries.
5:15.
Yeah? I think you'll have to stay home tomorrow.
Yeah.
But after that, you can probably go back. And we want you
Look, I'm sorry.
to
I
keep
promise I will get there as
your
soon as I can.
wrist up around
No,
your
just,
heart.
Keep them waiting.
But I hurt
give
you,
them,
I didn't mean to hurt you there.
Stand up presentation, give them a tour,
I
give them coffee, whatever.
This is your
Need-
wrist, that's your
Okay.
heart, so you need to keep it up like that,
Yeah,
okay? And
yeah, we're just wrapping up.
when you take a shower, you put
I'm
a
sorry.
plastic bag over it,
You have no
so it doesn't
idea how
get
sorry I
wet.
I have to wash my hands.
am. All right.
Now,
Yeah, okay. I'll talk to you later.
No.
No,
I'm
not
ready.
now.
I will be there later.
maybe your brother can help you today,
All right. Bye.
okay?
Yeah. Can I wash on my hand?
You can wash the part that's out here, yes. I need to go over some instructions with you.
Okay,
He shouldn't get his hand wet,
okay.
and he should keep it elevated for the next 2 days, for about 48 hours.
2 days?
Yes, and he needs to probably stay home from work so that he can keep it elevated.
Okay, I got a problem with 2 days, and it's...
I can't watch-
I have to work, and I can't watch him for 2 days, and I got nobody else. I mean, I got no one.
Has he ever been sick before? You've never had to get some help?
I've never had to do the 24 hours. I mean, he's always been able to go to work,
John, wait a minute.
and they take care of him there,
You
and
need
they
to keep
watch
that
him,
on.
and then when I come home from work, I love this guy, and I take care of
he's
him, but
nice, huh?
I can't do 24 hours.
I think that maybe the best thing is for you to stop and talk to our social worker and see if she can help you find somebody to stay with him if you have to work. He really needs to keep his wrist elevated for the next 24 to 48 hours, pretty much all the time. And he can't do that if he goes to work, right?
I
Yeah.
can't work.
Okay.
So
We'll
And-
deal with it, okay?
So he can't get it wet. You can use ice packs around it. And there's a bunch of other instructions here.
ice.
You can wiggle your fingers, right?
Okay,
Yeah.
we kinda gotta fly. I mean, I have to get back to work.
So you want to be sure that he can still wiggle his fingers,
Okay,
okay? But,
now keep it up there, okay?
and there's one more thing. You do need to make an appointment with Dr. Hughes in a month,
I will.
okay, and bring him back.
I call him in a month and make an appointment.
Yes, or you can make it now, whatever.
Okay, okay. I think we're good.
Nice, good if you make it before you leave, but if you don't have time, call in the next couple
right.
days.
You all set, guy?
You'll help with the washing.
I'll help.
the-
I'll help. Let's go. Come on. Get you home.
Okay, John.
What was Sue's goal, and how did she communicate differently with John and Hal?
My goal when I came back into the room after the cast was applied was to make sure that both the patient and his brother understood what had to happen. So I wanted the patient to understand that he needed to keep his wrist up above his heart, and I wanted the brother to be familiar with the directions for cast care and to know how he had to take care of his brother for the next couple days and when he had to come back to see the doctor. I felt that I did really well with John, the patient, but I felt that his brother was distracted, and I wasn't sure that I got through to him. I wasn't sure that he really understood what to look for and what to be concerned about. So I just have to trust that he can read the instructions. But I'm never comfortable when I haven't actually gone over things with people. If I had been able to get him outside of the room while his brother was having the cast applied and talk to him separately, I think I would have had a better chance of connecting with him and making sure that he understood. And it was a time that I was doing something else because we had other patients. It was difficult to manage the communication with the two of them because each one had such a different level of understanding. I hope that I did pretty well with John, the patient, and I think I did pretty well with the brother, too. I do think so. I was basically concerned to have the patient understand what he had to do in terms of positioning his wrist and wearing the sling. And that I decided that that was really all he could handle. And I then decided to tell the brother any other instructions that were necessary in order to take care of the cast.
How would you have handled John and Hal differently?
If I had another chance to do it, I would try to talk to the brother in between while the doctor was putting the cast on. I think that if I had had him alone, that I could have talked to him, and it was time he had to wait anyway. So that would have been, I think, a better time to try to give him those home care instructions. Once the cast was on, he wanted to go. If I was going to work with this situation again, I would try to give the brother the home care instructions for taking care of the cast while the doctor was putting the cast on the patient. It was time that he had to be there anyway, and I think if I could have been alone with him one-on-one, I could have gone over those instructions in a way that would have made me more comfortable that he knew what he was going to do. So I think that would have improved his ability to focus and concentrate on that.
When working with a patient with decreased understanding, such as mental retardation, it is important to relate to the patient on whatever level is possible. Particularly when the patient is injured and in pain, the medical assistant must validate the patient's feelings and provide a sense of comfort and care. It would have been easy for Sue to ignore John and talk directly with Hal. Although she was not completely successful in helping John to keep on his sling and elevate his arm, Sue demonstrated respect for him as a person by instructing him directly. We have seen two different types of patient education where medical assistants encountered patients who had difficulty understanding instructions. Mrs. Hernandez had language and cultural differences. John Daly was mentally retarded. The presence of family members made these situations more complex. Although it may be tempting to talk primarily with family members, it is important to establish verbal and nonverbal connections with patients and help them be responsible for their own health care.